Greetings. This is Justin Allen, the Elite Nurse Practitioner. This is the IV Infusion and Injectable Clinic course. This is the Elite Nurse Practitioner guide on how to start a successful IV Infusion and Injectable clinic. IV infusion clinics are popping up all over the place because they are in demand. Patients love the way they feel after they get an IV infusion. And so this is a great niche practice to start or to just integrate into your already established practice. So why IV infusion therapy and injectables? Nutrient and vitamin treatment are hot service lines, okay? They are very, very popular amongst patients right now. They love it, all right? They just absolutely love the way they feel. The demand is high as patients are getting older and looking to enhance and optimize their life. There are a huge amount of patients out there that are in their 30s and 40s, basically the beginning of the millennial group and the end of Generation X, okay? These people have a disposable income. Their careers are starting to blossom and they have money to spend and they like the way they feel. So these are your patients. It can be started very cheaply. You can get an IV infusion practice up and running for $5,000. It doesn't cost that much to do this, especially if you go the mobile route. All right. You do not need to spend that much money to create a profitable, successful little side hustle. You do not. It produces results in your patients. The patient walks away feeling the effects. It's not like prescribing them hypertensive medications, diabetes medications. They barely feel anything, if at all, okay? It's not like putting them on weight loss meds or hormone replacement therapy that takes months for them to start seeing benefit, to start feeling better. They walk out of your practice feeling better almost immediately. They love it and they will be back. It is a low liability service line. Practically the only liability associated with this is the IV itself. If you're not using sterile technique, problems can happen, all right? As long as you're doing it safely, there's very little to worry about here. The work can be outsourced, okay? So as a nurse practitioner, you can outsource this work to RNs, LPNs, EMTs. They can do the work for you, so you build a passive income stream. To generate real wealth, no matter who you are, you must generate passive income sources. Time for dollars, okay? Active income, passive income. Active income is you seeing patients. Passive income is you sitting on your butt watching TV and making some money. That is passive income. And so this is a great source of passive income for the astute nurse practitioner entrepreneur or even the RN entrepreneur out there that wants to hire people, all right? So we're going to talk about all of this stuff. So what is infusion injectable therapy? It's pretty simple, guys. It's just administering micronutrients directly into the body. Vitamins, minerals, amino acids. You can also administer various medications, Zofran, Toradol, Pepsid. You can administer these things directly into the body so the patient feels better. Both of these elicit a therapeutic effect when injected or given intravenously in the body. Most of you listening to my voice have probably done some sort of IV infusion therapy or given a medication via an IV at some point in your career. I certainly hope you have, okay? It's very safe. It's pretty straightforward. Now, what are injectable infusion therapies used for? Okay, some of you might be asking, well, what are you going to use these things for? A multitude of different things. Dehydration. People might just be feeling a little dehydrated from a night of drinking, or maybe they went on a super stressful hike, or maybe a marathon. Maybe they are just a little dry. Maybe they had some sort of gastric enteritis or something. They've been throwing up and having a lot of diarrhea. They need some fluids. Anxiety, depression. A lot of these calm the mood. Autoimmune diseases. A lot of these IV infusions are immune enhancing. Myalgia, pain. A lot of these help with pain. Fatigue, recovery, hangovers. I already mentioned that. Hangovers are a big one. You better be open on Saturday mornings. Athletic performance. A lot of people love to have a bag of fluids before they go on a super stressful hike, bike ride, marathon, whatever it may be. Nausea, obviously, you're going to be given Zofran for that. Hair and nail health, okay? Skin health, rejuvenation. A lot of these compounds, like biotin, for example, are great for hair, nail, and skin. There are infusions for weight loss, anti-aging. A lot of these compounds have anti-aging properties to them. Immune enhancement, I've already mentioned that. Infections, drug alcohol withdrawal. NAD plus is great for drug and alcohol withdrawal and to treat addiction, okay? So we're going to go over these things. It can be used for a lot of various ailments and symptoms in your patient. So what is IV infusion therapy? It's the administration of vitamins, nutrients, medications directly into the bloodstream. It's instant delivery. It bypasses the digestive track, 100% bioavailability. So you get almost 100% absorption, 100% bioavailability, okay? It can be administered in the clinic, in the home, or even at events, okay? Does require some basic equipment, okay? If you're going to be doing this either in your office, mobile route, going to patients' homes, or maybe even going to like some sort of event, whatever it may be, you're going to have to bring a little equipment with you. You need to have a set plan. We're going to go over that. So what are injection therapies? Injection therapies are similar to the IV infusion. You're basically administering the same kind of medications, nutrients, vitamins, okay? But you're only giving it to the patient IM or sub-Q. It does have a little bit of a slower delivery, not by much though. It's fast to administer. Patient comes in, they get their shot, they leave. There's less regulations surrounding it. IV infusion does have some regulatory considerations that you need to know about. We are going to go over those. Giving someone just an injection of vitamin D, there's really not a whole lot of regulation around that. It bypasses the digestive tract as well. And the good thing about an injection, it can be administered practically anywhere. Really, no equipment's needed outside of just some basic injection supplies. You really don't need that much. So, combination of IV infusion and injections makes for a great, powerful niche service line. Like I mentioned, it makes for a great service line for established practice owners or as a standalone practice, okay? If you already own a practice, why not implement this? If you're looking to start a practice, why not start a little IV infusion or injectable clinic, right? It's a piece of cake to start. It's very, very cheap to get started. You can get this implemented in your practice for $1,000 to $2,000. It does not cost that much to get this started. If you're going to do it as a standalone practice, if you're going to start from scratch, it's going to cost about $5,000 to $10,000 to start it, okay? It really depends. That number is going to vary depending on the amount of rent, the amount of equipment you need to buy, those kinds of things. So it can be started fairly cheaply. Low overhead and expenses. It does not cost that much to do this. Typical cost of an infusion for the clinic is going to cost you, the clinic, anywhere between $25 to $100. And that's going to solely depend on what the ingredients are, the medications, and those sorts of things. So it doesn't cost that much. And it's relatively easy to start. If you are a nurse, okay, you should have experience with starting and managing an IV. I mean, we've all been trained to do this. You need a handful of supplies, ingredients, and a space to do the infusion. Unless you're going mobile. If you're going mobile, you just go to the patient's house, do the infusion, and then you're out. But the whole point of this is that it's relatively easy to start. It's not very expensive, and it's a pretty easy thing to get started doing. Now, there's two types of IV practices: treat and street model and an ongoing continued care model. Treat and street is like the ER or the urgent care. It's a very simple model. Or you can do an ongoing continued care kind of thing, okay? Maybe more like an established wellness practice, integrative medicine practice, whatever it may be, okay? You see the patients for their ongoing needs, hormone replacement therapy, aesthetics, weight loss, whatever it may be. It's a great service line to implement into a standard practice or wellness practice. It just increases your bottom line and it increases your revenue. I think you guys are really going to enjoy this course. We go over a lot of topics in this course that I think will enhance your practice, increase your bottom line, improve patient satisfaction, and ultimately improve your life. All right, so let's get started.